Welcome to the Get Your Healthy Life podcast, the space where hope, healing, and holistic wisdom come together.
We don't use direct moxa because it will put directly on your skin and it can lead to scar tissue. And that's one of the treatment back to old time when we don't have medication or other things. But indirect, you are going to hold the mugwort pole, either traditional one, which smells like marijuana, but not exactly the same, or you could use the non-traditional one, which they took off some ingredients. It's not as smelly as the other traditional one. So patients can use that to do, like they lie down to do belly, they do hand, the feet, like hold the moxa pole. But we still need to differentiate it if it's fit for everybody. If you have a lot of heat, then I won't use that because that's heat. It's part of the heat therapy. So when you burn the herbs, certain ingredients can penetrate the capillaries and adjust the circulation and bring the fresh blood to that area. You would see a red spot around there. I don't use very often, but I do use that for women who wants to turn the baby head to the right position for each baby. Yeah, I have to choose the time that there is nobody around me. Otherwise, they will complain I'm smoking marijuana.
Okay, well, some of us are not new to mugwort. We just didn't realize that it was used in that fashion that you do, but yeah.
Yeah, I was accused when I was in a big office building. Now I can open my window and I choose the time. Yeah.
Yeah, wow. You got to be careful.
Yes. And also I will show people who have digestive issue and I'll show them how to do that at home. So they can do the self-healing, like acupressure, like here, there. I can show them to do. That's for the eyes, but for the belly, we have other points. So it's a method that you can do yourself. Just don't burn your house.
I have the oil. I don't know. I think I got it to kind of like enhance my dreams or whatever. That's why I got the oil. So I don't know. I might have the herb. I'm not sure right now. But let me ask you, how exactly do you start examining people when they come into your office? I know that you look at the tongue, but can you tell us a little bit more about that?
I have been practicing 30 years and then I'm a very sensitive person, so I can feel the pain. I have a lot of pains during my lifetime. I have 3 children. So I usually talk first. I'll get medical history and I watch them walk to the treatment room. Their posture when they're sitting in the waiting room. And then, if they have low back pain, they cross leg, and then of course you're going to put more pressure on lower back. So, and then once I started talking, and then I'll take the pulse and take a look at the tongue and see their circulation. For instance, diabetic patients, if you look at the tongue vein underneath there, it's all purple enlarged, and that's one of a sign showing that their circulation is not good. They need to improve. So that takes a long time. But if I just take a look at the tongue like this, and then I'll see if the tongue has the red dots or if there's a very thick coating. If this patient has very thick coating and then his digestion or her digestion is not perfect. He has some food stagnation. He might eat too much spicy food, too much greasy food. So and the antacid medication also block your acid. So you wouldn't be able to absorb the protein and the vitamins more efficiently. So that's another thing I could tell easily. And then I started palpitating if they have abdominal pain or lower back pain. I'll see where is the tender spot, if the nerve get compressed, or if there's a tender spot on the belly, certain belly area for appendicitis or for liver. So that's how I approach that.
That's amazing that you can tell so much from the tongue, that's amazing. Yeah.
So that's not invasive, but we do need MRI sometimes. Yes.
And those are helpful tools. It's always important to get that, whether it's blood work or a diagnostic test done, and then come to, an alternative specialist like yourself and then you have options for treatment, right?
Yes.
Yes.
Yeah, at different stage, we can do different treatment. Like for chronic pain syndrome, initially when inflammation is everywhere, then you palpitate the back and it's just tender everywhere. Then you don't want to use strong stimulation, gentle stimulation so that they relax, they go home, they sleep better, they get better energy, their digestion get better. Once they get better sleep, then we need to quickly get rid of the inflammation. And that's how we started doing electric acupuncture or thicker needles with manipulation. And then by that time, they already accept or get used to acupuncture. If the first time you use thick needle and it started turning, and they may feel so sore afterwards, and psychologically, they think that it may be worse and they may not continue.
Yeah, that wouldn't be a good first impression. So, yeah.
Yes. So first step, relaxation.
Yeah.
Yes.
So there's so many symptoms of chronic fatigue, right?
Yes.
And we were talking before, and you were giving me several different examples of how you would approach the symptom.
Yes. Like, for instance, the liver qi stagnation is more like an energy blockage. So we're just doing certain liver point and, of course, digestive point to smooth the energy flow so they can relax. And also we do something on the top of the head to stop thinking. So the most important things for them, relaxation, sleep better, so their energy flow better. That's one kind. And the second kind, like dampness, phlegm, it's more related with long-term indigestion, or they're in the humid weather and their digestion is slowed down, or they eat too much cold food, drink ice cold water, so that their digestion was not good. Then they produce phlegm and dampness, and those things can stay in the body and block the energy flow. That type, it's better to combine the herbs, because that's more you deal with not energy flow but also the phlegm, not only. So you do more things. And the third one is when this phlegm condition or energy blockage cannot be resolved timingly, then it will go on blood stasis, and you will show the purple vein there, and there's specific spot they have pain, or the pain lasts more than 6 months and never get relieved. That stage, you have to combine acupuncture, moxibustion, and exercise, and herbs. That also take a longer time. So there's a different stage and different patterns we can differentiate.
Oh, that's amazing. Now, you had mentioned anemia. What role can anemia play with chronic fatigue? With the blood?
Anemia is more blood deficiency. And so the pale color, pale nail, and if I see your eyes, this eyelid,
white.
I can tell how many grams of hemoglobin you have by just looking at your eyelid. So if it's deficiency, of course you're going to be tired. And then that deficiency also related with the spleen deficiency, because it does not absorb nutrients well. And it could be iron deficiency or vitamin or minerals.
Wow. You know what? I think back, and I've had a little bit of all of that after my chronic fatigue. So I feel like for some people, this can often be like an ongoing issue. You know what I mean? It's kind of like one thing leads to another.
Yes.
Oh.
So I think to start with, if this person is very, very tired and they wants to start and they wants to start a treatment, start acupuncture 5-6 treatment. At the meantime, started combining herbs, and that way you can improve the digestion. First, acupuncture do a good job to smooth the energy flow. That's why they have faster effect, more efficient. And then once you sleep better, you have more energy, right? You have more motivation to do exercise. And then the herbs take a little time to kick in to clear up the phlegm or improve the circulation. Those take time, but using acupuncture to give you more energy, to temporarily make your adrenal gland produce more cortisol, make your thyroid produce more thyroxine hormones, that give you a jump start to do all the things you can do yourself.
Yeah. Well, I think a lot of people need to start with something. So that's some great information you just gave us. Yeah. Let me ask you, earlier you talked a little bit about acupressure. Can you tell us
Yes.
a little bit
Yes.
about acupressure?
So I'm trying to do a lot of YouTube video about acupressure, like the acupressure on the large intestine point. Like you put your hand like this. It's all on my YouTube channel, Boston Chinese Acupuncture Li Zheng.